Hello, my name is Elizabeth Bryant. I'm a student at Maryville, the psychiatric mental health nurse practitioner student. For this assignment, I'm working in a role as a provider providing both pharmacology and psychopharmacology and a psychotherapy. I have just evaluated a new patient for this assignment, and I have diagnosed her with major depressive disorder. I've also determined that she would greatly benefit from both psychotherapy and psychopharmacology services. I will explain to this patient my philosophy on therapy and what type of therapy that I can provide. I will also explain to the patient why it would benefit her to see me for both therapy and medication management. To begin this conversation, I will explain the basic principles of psychotherapy. Psychotherapy has four primary elements. The first one is caring. My role as a Pmhnp is to care about the well-being of all my patients. I went into this field as a calling to help others. I believe that taking care of others when they are in great need is a privilege, and I treat it just as that. My foundational training is in nursing. As a nurse, I am heavily grounded in the art of healing through acceptance, non-judgmental understanding, and empathy. The second element of psychotherapy is connection. A respectful human relationship is a powerful tool in psychotherapy. The connection between the psychiatric mental health nurse practitioner and the patient is a sacred one. There is a level of trust and understanding that evolves over time once the initial barriers are removed. I believe, as any relationship between two people, there are some that work better than others. My philosophy on connection is simple. Open your mind and make every effort to connect with the patient. If still there is tension or barriers, don't be afraid to refer to another provider who may have more experience in the type of therapy needed for this particular patient. The third element in psychotherapy is narrative. The dialogue between the provider is where the real therapy begins. I believe in the art of listening and connecting feelings with past events and understanding the relationship between these two as it relates to the patient's life. As I work with a new patient, it is important to inquire about childhood experiences, relationships with family and friends, and history of depression, anxiety, or other manifestations of mental illness. I believe in working with my patients to gain understanding and closure to painful events or trauma. I want to help my patients understand and unlock the doors hidden deep in their subconscious mind. Often the issues of stressors we have as adults can be tied back to childhood memories or bad experiences. Bringing these experiences to the forefront of the cognitive mind helps the individual to interpret emotionally charged situations in adult life that may have a similar theme. The last element of psychotherapy is management of anxiety. One of the most common mental health issues is anxiety, which can occur with or without depression. Many people are crippled by anxiety. When treating a patient with anxiety and depression, it is important to get to the root of their anxiety or depression as to try to cure it. This process can often be painful for the patient to reflect that deeply inside themselves and can bring up increased anxiety or depression while disclosing. It is important to peel back the layers of the situation gently to solve the problem and the issue that is at the core. The benefits of combined psychotherapy and psychopharmacology. I believe the benefit of the integrated treatment, which is the term used to describe the model of care in which the patient has one provider for both therapy and medication management. There are many benefits to this combined approach treatment. First and foremost is continuity of care for the patient. The integrated therapeutic approach allows patients to make one appointment to receive therapy as well as medication refills or changes to medications as needed. For the provider, this approach is very rewarding as the Pmhnp has a close relationship to their patient and is best able to treat the mental illness based on the pattern of symptoms reported to the patient over time. Split treatment approaches can be frustrating to the patient due to having to see two different providers. Many times the collaborative efforts between the two providers is minimal at best, and there may also be differences in styles of treatment between the therapist and the prescriber. The training that a Pmhnp provider undergoes is an integration of biological, social, behavioral, and neuroscience, along with theoretical understanding of mental illness, sleep cycles, and much, much more. The scope of practice is broad and encompasses all aspects of mental health. The Pmhnps are at a one-stop shop for mental illness. As a Pmhnp, I feel some of the biggest advantages that our nurse-based model of patient care brings is the holistic nature of care for our patients. I believe and have been trained to incorporate the entire person in my care model. I believe strongly in the mind and body connection with mental health and physical illness. The other areas where Pmhnps cast shadows upon other health professions is patient education. As nurses, we are trained to educate patients and family members extensively. This role is further expanded on as the Pmhnp is an integrated care model. In the integrated care model, mental illness is a comprehensive, and often there is misconceptions and stereotypes that may affect the care. So it is important to provide a solid evidence-based facts to dispel any false beliefs. Over the last decade, the evolution of mental illness has made tremendous gains. The term brain disease is increasingly being used to mitigate stereotypes. No different than diabetes is a disease of the pancreas, bipolar disorder, schizophrenia, and major depressive disorders are disorders of the brain. My personal philosophy is not to just look at the presenting symptoms of the disease, but also look at how the person became this way. What developmental processes were involved in the evolution of this disorder? Now, as a new therapist, there are going to be many challenges, and I say one of the biggest challenges, as with anything, is integrating into practice. One of the biggest issues in transitioning is the transition from being an expert nurse, where you feel very comfortable and confident in your position, to being a novice Pmhnp, and feeling like you're barely at the beginning and have a lot to learn. So the philosophy of therapy that I use is pretty simple and basic. I believe that therapy is a safe place where a patient and a therapist exchange ideas, thoughts, and feelings freely. The therapy is beneficial for everyone, not just severely mentally ill. In fact, patients who benefit from therapy the most are high-functioning people who have situational or chronic mental illness that is manageable in the outpatient clinic. I believe that mental illness is on a spectrum. There is no one-size-fits-all solution to mental illness. There are varying degrees in which mental illness affects the lives of each person. This can be measured by the extent to which mental illness affects their ability to function in a job and with interpersonal relationships. The type of therapy that I provide, I do provide a variety of therapies. I do really like the cognitive behavioral therapy because it's very inclusive. There's many different types of therapy. One very popular one that I like is the relaxation therapy. I believe this can be very beneficial in treating sleep, headaches, alcohol abuse, hyperactivity in children. Another type of therapy, a form of therapy, is identifying and modifying maladaptive schemas, which addresses the patient's cognitive beliefs in themselves, the world around them, and their future. Modifying this thought process in patients is very successful in patients with unipolar or major depressive disorder. This and many other types of therapy can be used for different situations. I hope this information has been beneficial to the patient's decision to start integrative therapy with me as soon as possible.